National Colorectal Cancer Awareness Month, and you may not know that colorectal cancer disproportionately affects the Black community. African Americans are about 20% more likely to get colorectal cancer and about 40% more likely to die from it. Here to talk about this is Dr. Chioma Anju, a gastroenterologist with Hartford HealthCare. Doctor, welcome. Thanks for being with us.
Thank you for having me. I'm actually not Dr. Chioma, but I'm Dr. John Wysocki, but thanks for having me nonetheless.
My apologies, Dr. Wysocki.
It's all right.
All right, 40% more likely to die. That is a startling statistic. Why are Black men and women more at risk?
Yeah, I mean, absolutely. It's a startling statistic and kind of comes in the heels of an interesting time. You know, February is Black History Month, and then in March is Colon Cancer Awareness Month. So definitely an interesting time. But as you read, I mean, those statistics are startling. And we do know that that African American population has the highest risk of any racial or ethnic group in the United States for getting colorectal cancer. So many things can happen that can put them at risk of that. And what we do see is the fact that the death rate is just that much higher. I think emphasizes that a lot of the times the diagnosis comes a little bit later in its time course and actually leads to a more challenging outcome, which can include death. But, you know, one of the most recent things that we saw in Hollywood with that actor from Black Panther, Chadwick Boseman, just emphasizes and highlights, you know, that we all have to be aware. He got diagnosed pretty young in life, in his late 30s, early 40s, and unfortunately at age 43 he passed away from colon cancer. But there are many reasons to this. It's a complex dynamic, you know, certainly a focus of clinical research, but you know, there's definitely a lack of access to healthcare that we see in the population. There are genetic risk factors that certainly put them at risk compared to other ethnicities. There are lifestyle factors such as tobacco and obesity. There's certainly the social stigmata that comes with the colonoscopy that we all hear about. And then there are also a variety of socioeconomic risk factors that put them at a higher risk. But, I mean, fundamentally underlying all of this, there's an access to reliable, affordable healthcare options that's certainly a topic we need to get out there. And then we also need to ensure that as providers, we're making sure that people are adhering, you know, both primary care and OBGYN, gastroenterologists, et cetera, that we're all adhering to guidelines and recommendations in terms of when screening should be. And for average risk African-American population, that age is 45. So
wow.
And we found the earlier you find this cancer, the better the outcome is going to be. So awareness is essential to this. Okay,
very eye-opening. What are some of the signs and symptoms of colon cancer?
Great question. You know, you can notice something just as subtle as just a change in your bowel habits, you know, such as diarrhea or constipation. Some people notice some rectal bleeding. You may have some cramping, abdominal pain that is persistent and just doesn't resolve on its own. You know, you have the occasional meal you may eat where you ate the wrong thing and you feel that indigestion, but we're looking for more persistent symptoms that may be there. Some people have weakness and fatigue. Some people have unexplained weight loss, but in many cases, quite often, we do see that patients actually have no symptoms because this can be a very slowly evolving process. And that's why it's important not necessarily to wait for symptoms, but to try to adhere to those guidelines of when...
Okay, doctor, we just have 30 seconds left, and I wanted to put up the information about your webinar that you have coming up with Hartford HealthCare. There it is, March 24th, 6 p.m. Do you encourage people to register for this real quick?
Absolutely. I think it's a wonderful event, a free webinar all about colon and rectal cancer. Wednesday, March 24th at 6 p.m. So certainly any and all are welcome, but with a particular focus on African-American community and just getting the message out and getting people screened because it can prevent colon cancer.
All right, Dr. John Wysocki, thank you so much for joining us.
Thank you.